It's been a little more than a year since North Adams Regional Hospital shut down, putting 500 people out of work and causing residents in Northern Berkshire County to wonder how their medical needs would be met. After weeks of negotiations involving local and state leaders, Berkshire Health Systems stepped in to fill the void last year and to restore emergency services and several outpatient services. I sat down with Ruth Blodgett of Berkshire Health Systems, who provided an update on the situation.
When North Adams Regional Hospital announced it was closing, it was very sad for everybody, first and foremost. And I think there was a fair amount of grief and sadness and concern by all. At Berkshire Health Systems, we had a few days' notice to work with folks up here in North County to make sure that the people of North County, the patients, the residents, would have a seamless transition of care, that we would be in a position to care for as many people as possible without any interruption. So, for example, there are about 150 patients that were home with the Northern Berkshire Visiting Nurse Association and Hospice. And with the support of the government officials, we were able to get through some regulatory hoops and be able to employ those folks and be able to care for those 150 patients without a hiccup between the closure of North Adams and Berkshire Health Systems stepping in.
So when you moved in to kind of help and to revive these services here, how were you met?
You know, it was really a wonderful experience. Although, you know, as we mentioned, it was sad. But that being said, this community is a very resilient and a very welcoming community, and people have come to work together to meet whatever challenge that they have faced. And we found the same thing. We found the government and elected officials extremely helpful. We found the business and community leaders extremely helpful. We found the residents helpful and welcoming us with open arms. The trustees understood the importance of the entire Berkshire County region and everybody that lived here, and if we could extend our services to care for all of Berkshire County, that was a good thing.
Now, I know that there were 500 jobs lost when the hospital closed. You've rehired 250
That's
people.
Correct. Yeah, over the last year, as we have added back services to North County, as well as supporting the services that are available at Berkshire Medical Center, we've added about 250 jobs. That's actually been a great process for us, and many were brought on very quickly, again, as part of this making sure we have access to essential services. But we've been really fortunate to hire great people, physicians, staff, nurses, technologists, you know, all types of folks in healthcare with great credentials, and they've got great skills. And I think most impressive is their deep devotion to their friends and neighbors in North County.
I think you had talked about a little bit about the closest hospital being in Pittsfield or in Bennington, Vermont. And while healthcare has certainly changed, for people who live here, that's an emotional attachment and something that might make them uncomfortable. Are there plans to perhaps bring a hospital back at some point, or have the healthcare needs changed?
Sure. So if you go back several decades, most healthcare was provided in an inpatient hospital setting. Today, most of healthcare is provided on an outpatient basis. And our focus has been what do the most people in Northern Berkshire County and the surrounding areas of New York and Vermont, what do they need to maximize their health? What do they need for prevention, for health promotion, for diagnostic services, for access to emergency care, for ongoing healing and treatment support? And most of those, we've been focusing on the services that most people need, which are predominantly outpatient services. The state commissioned a report from Stroudwater, which we call the Stroudwater Report, which looked at the needs of Northern Berkshire, and that's been a great blueprint for us to understand the needs of the Northern Berkshire community. It helps lay the priorities for us in terms of what we need to do to restore health for the residents of Berkshire County.
Okay. Ruth Blodgett, thank you so much for sharing your time with us today.
Thank you. It's my pleasure to be here.